Hello, I am Dr. S.K. Singhal, cardiologist at Pandit Deendayal Upadhyay Hospital, Aligarh, posted here. I will discuss latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable disease, of which 27% are attributed to CVD, which affect 45% pupil in 40 to 69 age group. Raised blood pressure is among the most important risk factor for CVD. Moreover, it remains poorly controlled due to awareness about hypertension, lack of appropriate care through primary care, and the poor follow-up. India, the prevalence has also gone up to 30 years of 38% in men and 32% in women from 29% and 28% respectively, WHO. Despite that, nearly half of the pupil or 50% of men and 40% of women the hypertension were aware. Women living with hypertension did not get the treatment. Medication are used to control blood pressure in, however, 1 in 5 in men and 1 in 4 in women with hypertension worldwide. The International Society of Hypertension has released the ISO 2020 Global Hypertension Practice Guideline. Inclusion of optimal and essential treatment paradigms attempt to address the issue that in resources poor setting. Optimal care reference to evidence-based standard of care, whereas essential standard refer to minimum standard of care to allow the specification of essential standard of care of low resource setting. The AHA ACC has released the scientific statement in 2021 offering new guideline of management of stage 1 hypertension among the patient is low ASCVD risk. Among the risk adult non-ASCVD or 10 years CVD risk with stage 1 hypertension. Blood pressure is 130 to 139 oblique 80 to 89 millimeter of mercury. The management start with non-pharmacologic therapy if blood pressure remains uncontrolled at 3 to 6 months. Consider starting pharmacology therapy in stage 1 hypertension. Acute respiratory distress syndrome is promptly fatal condition involving the lung damage and expert often associated with severe CVD. Recently, study which appeared the Journal of American College of Cardiology report that metoprolol can reduce the inflammations and improve respiratory function in the people with COVID-19 induced ARDS. Lowering systolic blood pressure, target down the 110 or less than 130 millimeter of range, substantially reduce CV adverse event in STEP randomized trial, affirming the sprint finding for an older. Chinese population among 8,500 patients aged 60 to 80% in China, 60 to 80 years in China, the supporting lower target could unite the guideline, which even among US professional scientists, professional societies range from threshold of 130 to 150 millimeter of mercury. With regard to prognostic value of ambulatory blood pressure monitoring, nighttime blood pressure 2018 European guideline of management of arterial hypertension recommend that diagnosis of hypertension should not only be dependent of office BP measurement, but also an out of office measurement such as ABPM or home blood pressure monitoring. 24-hour nighttime BP measurement were associated with greater risk of mortality than and composite CV outcome. Thus, they may be considered as the most relevant measurement estimates CV risk. For every 20/10 millimeter increment of BP measure at night, risk of mortality increased by 23% and the risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guideline equally recommend five classes of antihypertensive drug considering high non-adherence treatment. Importance of combination treatment is practically highlighted to improve the adherence of therapy and BP control. Therefore, 2018 European guideline recommend, especially in context of lower BP target, to start antihypertensive therapy with initial dual fixed dose combination of ACE inhibitors or ARV plus calcium channel blocker or plus diuretics. Since early July 2018, product containing valsartan has been reduced, recalled worldwide. The reason is detection of known carcinogen, namely N-nitrosodiol dimethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by WHO International Agency of Research on Cancer to be carcinogenic in humans. If 1 lakh patient would have been received NDMA contaminated valsartan from Zhejiang, Hawaii, manufacture site where the highest level of contaminant were found. Every day for 6 years in the higher dose, it could result in 22 additional liver cancer over the lifetime of these patients. Presence of NDMA in these drugs could lead to 6 additional cancer cases in 1 lakh patients if they had taken the highest daily dose of over 4 years. While certain record accompanied by significant increase in rate of energy department visit of plus 6%. HYGEA study represents the largest study that tested the nighttime antihypertensive treatment. In the trial, chronotherapy were associated with significant reduction in the endpoint, including death. HYGEA chronotherapy trial tested where nighttime therapy is comparison to usual upon awakening hypertension therapy expert exert a prevalence cardiovascular risk reduction. Largest study included total of 19,084 hypertensive patients during an average follow-up 6.3 years. 1,752 participants experienced the primary CV outcome and ambulatory BP measurement was performed for 48 hours to collect data on how BP offered during sleep. BP reduction for CV event was significantly improved for nighttime treatment with compared with awakening treatment. Thank you so much.